And so the topic we're really talking about is, again, we're seeing that one of the top four problems or restrictions in growing a practice is the office training, hiring, staffing, basically the systems of an office. So we're seeing as doctors start learning patient retention, the practices come up when they start learning, some of the educational sales with marketing, the practice comes up. And then I'm seeing, one of two things happens. The next thing that happens is usually motivation goes out the window. And typically that's when doctors are out of survival and security. So that's its own problem in itself, and we have ways to, help that. But the big problem that I'm seeing really with, guys that are just, average to above average motivated is the office procedures. The office procedures are really inhibiting the doctors tremendously. And, the bad news about it, they're not even known. They're not even seen as an inhibiting factor. And I'll give you an example of that that's kind of like patient retention. I think I've never run across a doctor that says, I got bad patient retention. Well, matter of fact, I know for a fact, I've never had a doctor that said I have bad patient retention and I know my statistics. Never in 20 plus years. Because nobody keeps statistics. So when doctors have bad retention and they're losing patients and, they don't even know it. And so a common denominator there is they don't even know they have bad retention. And so they think it's all new patients. And of course, all chiropractors think, it's a new patient problem. And in my experience, it's been like a third. A third of the doctors, it is truly a new patient problem. A third of them, it's not a new patient problem at all. They're just losing too many patients. And then a third of them, it's kind of a hybrid. They're losing them and it's a new patient problem. It's kind of what I've seen there. But, one of the worst types of situations to be in is unconscious incompetence, when you don't even know of a problem. And it's the same with motivation. A lot of doctors, they'll go, I don't think I've ever had a doctor that says I'm not motivated or I have low motivation. Everybody thinks they're motivated. It's kind of interesting how that works. But the same definitely with office procedures. I have never had a doctor be aware consciously that they are inhibited with office procedures, and they know what's inhibiting specifically with the office procedures. Now, when I say office procedures, I'm talking about staffing, job responsibilities, placement, and patient flow and office layout. So it's several factors when I say office procedures. So it's not just staffing, it's not just layout, it's a combination. It's kind of like I call it the machine. That's the machine that turns the business. And if you don't have all those pieces in place and working harmoniously together, that becomes a seriously limiting feature. And so one of the main indicators that you have a office machine problem is one is high turnover. You got turnover, and the other one is you have patients waiting. Those are two grossly obvious indicators that you have an office machine problem. And it could be in any one of those categories, but it has to be evaluated. So having said that, I wanted to make sure we talked about this topic right here, which is employee motivation and what really motivates employees and what really doesn't. And several things that do motivate employees that the doctor is just not even aware of. So let me go into this. This is unbelievably important. This will pretty much make or break you. From the employee standpoint, understanding employee motivation will make or break you relative to turnover, high productivity or low productivity, staffing, problems. I mean, understanding and by the way, it's just the opposite. If you do apply, if you're aware of these and you apply them, it straightens out a tremendous amount of problems. So having said that, let's go ahead and walk through these four categories. So when we talk about the employees, the four, and again, this is the results of my experience of hiring well over 300 people, in 77 offices in 20 states. In other words, I have a tremendous amount of experience with bad. I made a lot of mistakes to learn what not to do and to keep refining it to where I had a pretty good idea of exactly what worked best and what did not. And so here's the category of motivation. So number one is the office purpose, and I'm going to get into each one of these with high specificity and give you some examples. Number 2 is the value and self-worth of the employee. And number 3 is the employee's personal motivation, and then there's what I call the professional or the educational motivation. So we're dealing with multiple factors of motivation here. So if we start, and let's go into the office purpose motivation first. So again, all employees crave security. They want to have a sense of purpose and clarity. No employee likes to show up when they're not secure, there's no sense of purpose, and there's no clarity. Nobody likes to go to that kind of destination. Now, they want to know they're spending their time and energy for something worthwhile, valuable, and bigger. Okay? And so that's the role of the doctor, is to make sure that he gives purpose, clarity, and direction. And the 2 categories that do that is the purpose statement and the mission statement. And so there should be a purpose statement in your office. What are you doing there? And I'll just tell you this, I make my employees memorize it. So they have absolute clarity that there's something bigger and better and that this office is moving toward. And that becomes, remember I talked about the couple different types of motivation. The worst motivation is money. It's the absolute worst. But if you're in survival or security, that's where you need to be. But once somebody's out of survival and security, money becomes a very low motivator, and then the next one is personal gain. The bad news about that is it's about the individual. It's not about the team or the productivity or something higher. And then the third form of motivation is a personal experience, a personal emotional experience. And so we're going to go into that a little bit. And then the highest calling of motivation is the self-actualization, doing something for a bigger cause. Everybody wants to do something for a bigger cause. And you have to give that. You have to give that to your employees. And that's what your office is doing. And that's what a purpose statement does, and that's what a mission statement does. It gives a bigger cause a higher calling. That's what it is. And so I recommend you not only have it, but you write it down. It's real simple. Just make bullet points of what they are. And then it should be on your wall. It should be very obvious where patients come and go, and they can easily see it. And then I always make sure that the employees memorize it. I want them to know that it's not, that there's something bigger that we're doing here than just collecting a check, because that's a low motivator. So anyway, the purpose statement is basically a declarative statement which summarizes the specific topics and goals of your practice. So just point down in bullet points, what are some of the goals of your practice? And I touch on things like, who we want to help. And then I may say a quality factor, a service factor, things like that. And then a mission statement is a formal summary of the aims and values of the company. So what's your business value? And I'll give you a couple examples of, some things that I had is, big one was, I'll give you a couple big ones that I had that I made, it was unbelievably clear, and my staff knew. Number one was there was no waiting. I mean, I had policies where there was no waiting. My systems were no waiting. Patients were not allowed to turn around and sit down after they filled out the paperwork. Everything was designed for them, the whole flow, everything. The people, the staff, the space, the equipment, everything was designed where it didn't matter if it was 300 visits a week, and, it was designed that way. And we kept redesigning it as we kept growing. In other words, one design won't satisfy another design, and so it's got to morph to come up. So that's an example of, I was real clear in what I valued. Another one is we never turned a patient away for care, never in my life, and I wanted to make sure that my staff knew that. That was a value of the business. And it creates something bigger. It creates respect. It creates authority. It creates something of greater value. And same with turning a patient over to a collection agency. I never in my life have ever turned one patient over to a collection agency. And there's obviously patients that don't end up paying for whatever reason. So we got better on the procedures, but that was just a value. I'm like, no, you know what? If I don't have the ability to take care of it and do it right the first time, I'm going to go ahead and just consider that a write-off in charity, and I'm not going to cause any problems with people. And those were huge values of the company that I projected onto my employees. In other words, I created the values of the employees. I didn't let their values come in and take hold of my business, because chances are, if they had better values of what they wanted, they'd be starting their own business. But so I don't want any employees that by definition are employee to come in and give me my values for my business and where I want to take it. They're going to take my values, and then we're going to go from there. And by the way, if you don't have this, that's what you'll get. And remember, you'll get entropy. You'll get the path of least resistance. So these things, although they seem trite and overly talked about, they're unbelievably important, because all of us want to do something bigger and better with our lives. And so if you do not have a purpose statement, if you do not have a mission statement, I recommend that you have a rough draft finished by today. And that it's cleaned up real quick, and it's delivered in your staff meeting next week in your staff meeting. And everybody has to memorize it. And it can be a working draft. I mean, it's no big deal, but get the thing moving. Let your people know that there's higher purpose and clarity and focus for them coming into your office, and that you're setting the tone for the purpose and clarity and direction, not them. So that's number one, and that's a pretty big one. Number two, and I got to tell you, out of all three, this might be the biggest. This could absolutely, in all likelihood, is the biggest motivator, this topic right here, which creates value and self-worth. Every employee has a deep-seated desire for self-worth. Every human being essentially does. So understanding what they do, people want to understand, employees want to understand what they do and how they do it for a greater cause. And that creates tremendous, and it's unbelievably vital for the employee's self-worth. What are they doing? Why are they doing it? And that it's attached to a greater cause. That's what creates a lot of things. It creates self-worth with the employee. It creates tremendous respect and authority for you, is what it does. And these are the categories of how it works. Number one is you should definitely be teaching your staff members the basics of the 3 phases of healing. Now, we're talking about 8th grade level here. You have to remember we're talking about, lower educated people. We're not going to hold them to like associate doctor standards. So they have to know the basics of this. Number 2, how your therapies are used based on the 3 phases of healing. In other words, you should be able to explain, and by the way, all of these, I make sure my staff members could explain them to me. In other words, there's a big difference me just saying it to a staff member. They'll forget about it in 48 hours. I not only wanted to teach them, they had to be able to come back and teach me. And that becomes very important for the learning cycle, and it gets much deeper. And I will tell you this, not only will it affect their self-worth and their value and their respect and authority, they're now going to feel real strong about referrals and trusting you and what you do with their friends and family members. That's what also will happen. So make sure that you explain each of the different therapies in your office and how it relates to the inflammation phase. How does this affect the inflammation? How does this affect any of the components in the repair phase? And by the way, it may not. You may have a therapy that's only used for pain and inflammation. That's fine. Then just say that. And this therapy wouldn't be used for any of the components in the repair or the remodel phase. But make sure that your staff knows every one of your therapeutic protocols, every one of them, and they know like a little bullet list, 2 or 3 bullets. This is how this therapy helps inflammation. This is how this therapy helps increase nerve sensitivity. This is how this therapy helps with increasing the strength in the repair phase, or the elasticity or range of motion. See? Now, the next is with the biomarkers. Same with your test. So I went through the OPPQRST, in other words, the symptoms of the patient. And I would explain to my staff what the mechanism of injury meant. How was it that I was able to gather information from their history to help interpret that to start to create a diagnosis and what the general problem would be with muscles, ligaments, tendons, organs, whatever. So the tests, and then I did the same thing with the basic tests you do, like ranges of motion. I taught my staff there's 3 ranges of motion. I taught them, the active, passive, and joint motion, and I taught them how I tested it and what it meant when I put somebody into extension and overpressure and it was painful. I explained what that meant. This creates value. It creates tremendous respect and authority is what it does, and meaning, personal meaning. And then same with the, whether it's range of motion, whether it's the muscle test, whether it's the nerve test, or the orthopedic test. You should go through the basic test with your employees and go, this is what we're doing and this is what it does. And I'm telling you, your authority is going to skyrocket. Their self-worth, they're going to feel darn good about what they're doing and who they're doing it with. This is motivation. This is very important factors. I go to the doctor's office and I can ask the patient about this or that, and they can't even tell me how the chiropractic adjustment, works or what treatment's based on. It's pathetic. And so, same with not just the different tests relative to the purpose of the test relative to the phase of healing, but also, what is the treatment based on? Your staff members are always hearing things like, did you get the check? Did you collect the money? Did it come in? Did they schedule the appointment, right? That's the stuff they're always hearing. And if that's all they're always hearing, they're going to see you as an SOB, money grub in SOB. And that does nothing for motivation. Nobody wants to work with and be around somebody who's always talking about, did you get the check? So you got to offset this. And so what's the treatment based on? Why are you seeing them daily? You should be able to explain that. Why are you seeing them 3 times a week? Why are you seeing them twice? What's that based on? You should be able to explain that their treatment is based on these tests and those tests relative to what phase of healing they're in. This creates unbelievable trust and value and self-respect, called motivation. And then how to determine the frequency of treatments. Again, we talked about that. The frequency. What's that based on? You should be able to explain that to them. That increases their conviction level of why somebody needs to be seen 3 times a week or daily or twice a week, and it's not just for the check. And how to determine if and I'll tell you this, and this is a real negative, and it happens a lot in chiropractic offices. When this is not explained, and then they notice that the patients with good insurance and personal injury insurance, they get higher treatment recommendations. And then the cash patients routinely get lower treatment recommendations. And you're hurting your credibility and your authority is what you're doing. So the next one is how to determine if the patient needs a referral. And this is an unbelievably big issue. And here's the issue. Make sure your staff knows what you do not treat. It's so unbelievably important that you are very clear on what you do not treat, because that's what creates credibility when you talk about what you do treat. And this never happens in chiropractic offices, because typically they're talking about the subluxation, and then they say how the subluxation treats everything. Or the subluxation treats the subluxation, and the subluxation creates all these symptoms, which is one and the same to the patient. So, you know, you want to lose credibility with your patients, go ahead and tell them you treat everything, or with your staff, go ahead and tell them you treat everything. So you'll create a lot of respect. Respect is what you'll get from that. Respect. When you point out, these are the things we don't treat, and this is why we don't treat them, okay? So same with the somatovisceral reflex. Tell them the truth about, that's the subluxation. Tell them the truth about the somatovisceral reflex. You know, how there's this thing called a somatovisceral reflex, and it can affect the autonomic nervous system. Sometimes it, you know, it can be an off-on mechanism with the organs. Most of the time it's not. And that's the truth. So, and then share the, and this is a big one. Always share a patient's case study, because now it gets personal. Share a patient's case study at every staff meeting, even if it's quick. In the beginning, I'll take more time with them as they're, you know, as new employees come on. But you always want to touch on it. Here's the key point, and I'll tell you the number one key point. When you share now remember, if it's a patient, it's personal. They see the patient coming and going, but they don't know how this patient is responding specifically in the back. So you want to do this to create value, and you want to get specific. But out of the things, and I'll tell you how I do it, but I'll tell you the number one thing that gives the most value when you cover a case study with your staff. And what it is so you go over the base. Let the patient go over, okay, this is the mechanism of injury. This was the, you know, this was their symptoms. You know, all the problems they were having, the OPPQRST, and then go over the tests. These were the positive tests, and that's how we came up with the diagnosis. And then these were the things that they could not do. They had pain or restrictions with the ADLs, the activities of daily living. So you just go through that flow chart and then do the follow-up. And it's typically after the first re-exam. So you take a patient after the first re-exam. And then you would just do a comparison. But I tell you, the most important thing to emphasize is the ADLs. And here's why. The ADLs are emotional. The tests are cognitive. And the emotional component is what they're going to pay attention to, not the cognitive positive KEMPS test. That's not going to mean anything to an employee. Now, I'm going to cover it just so they know what we do and how we do it, what it means. But a cognitive test is not going to carry nowhere near the motivation as when you cover what this patient could not do that was either painful or restricted within their activities of daily living, such as picking up a laundry basket. They couldn't pick up a laundry basket. Now they can. You see, that means something to an employee, not a positive KEMPS test, because it's emotional. It's the emotional factors that carry the motivation, not the cognitive. So I'll cover them both, but I'm going to put serious emphasis on the emotional categories, the ADLs, what they could and could not do in their life. That's it. That's what creates value for them. That's when they feel good about being there, working there. You're giving them value for what they do when they see how they're helping Mary Jane be able to pick up her laundry basket and do laundry now. That's important. So you're missing tremendous motivational self-worth, respect, possibilities by not doing this. And if they're just hearing you say, did you schedule the patient? Did you collect the money? That's when you become the SOB. And that is not motivating. Nobody likes to always hear somebody that's chasing the money. So the other thing is the truth about the somatovisceral or the patient's case studies at the staff meeting. I always like to do theirs. Always take your employees, do a regular workup, do a consultation if they have any problems, do all the normal tests, explain what it all means, and relate, x-rays if necessary, whatever. Do everything you do with a normal patient, but explain it to your staff member. Don't just do it. Explain what it means. Now it becomes very personal. And would you add to that what therapy you would use and why based on your test, based on the 3 phases of healing, and what frequency you would treat them based on their the phases of healing they're in. That's what creates, now you're at the top of the chart. You're creating unbelievable value, self-respect, and authority. Now, I talked about focus on the case study, the patient's symptoms, and the ADLs, because those are the emotional components. The symptoms, if they're in pain or not, frequency of pain, intensity of pain, and the ADLs. Those are those. I'll cover positive CHEMS test, range of motion. Those are not emotional. Emphasize the emotional components when you talk about patients, when you do case studies and you talk about them with your staff members. That's where there's meaning. Now, what I just shared with you has unbelievable value. That's when patients respect where they show up, like where they show up, have value for what they do, have a greater sense of calling for what they do, give you respect and authority, feel totally comfortable referring you, patients, their family members and friends, not only feel comfortable, they feel authoritative and compelled. This is what does it. Now, the next one is the personal motivation. The personal motivation starts with what are called the primary, secondary, and tertiary job responsibilities. And this is just human nature. Here's the deal. Every employee should have what's called their primary, secondary, and tertiary. In other words, they know what's most important, what's secondary important, and what's not as important at all. And the primary responsibility is always what they're hired for, trained for, bonus for, or fired for. And it can only be one thing. And here's the deal. It's a human fact if you have 2, 3, or 4 things that you're responsible for. And it wasn't pointed out which one of these is most important. You'll get a low performer in every one of those categories. Every one of those categories will be below what they could be. That's just a natural fact. As opposed to if there was one of those categories and you said, not only is there one, this is the most important one. Now you focus their attention. That will naturally bring that category up. Now here's what else happens. Nobody else is responsible for that category. So they can't blame anybody else. Now, what that does is it holds them accountable, meaning it makes them deliver more and makes them focus on the one thing that you want driven higher. It makes them pay more attention to it because they're the only ones that are going to affect it, and they can't blame anything else because there's nobody else that's allowed to share that responsibility. But remember motivation. Most of motivation is pain-based. So they're going to do everything they can to not let it go down because you're also going to share with them the negative consequences associated with that. And I'm going to go into that here in just a second. So we want to make sure they know there's a primary responsibility, no one else. It's up to them. They get bonuses if they do well. That's what they're hired for. That's what they're fired for, and that's what they're trained for. And you want to see a statistic and personal responsibility skyrocket. That's what will happen. And that's what you do. Now, what's important to them is, as an employee, that's what they want. This creates security. When they know what's most important and least important and where to focus their time and energy, that creates security. And all employees want security. One of the worst things that happens in a chiropractic office, and I see it all the time, is there's what's called diffusive responsibility. So, this person is responsible for this group of things, and this person, this group of things, they overlap. And oh, by the way, one of them's always running back. In the front desk person's always running in the back to do therapy or let them off therapy and running back to the front. I mean, it's nothing but mass confusion. And that creates a tremendous, so you have very low productivity. The doctor gets angry and frustrated because, some of the main things that are important to him are now going down, like collections. And then the staff members complaining, they're like, I can't do it because you're always making me run to the back to take somebody off therapy. In other words, you got total chaos because of this. It's bad management. It's bad systems is what it is. People want to know what is most important, least important. And believe it or not, people actually want to be responsible for it to a large degree. Unless it goes bad, then they don't want to be responsible for it. But they'll overwhelmingly step up to the plate and produce way better than if it was 2 or more people. Because if you have 2 or more people, a couple things happen. Number one, they always will they'll do for diffusive responsibility, and then they'll say, well, I'm not going to push as much because the other person's there and they'll do it. Well, you just lowered. Just because that was bad management, you just lowered the productivity of whatever that task was, naturally. And now they can blame everybody. And then also there's the homeostasis factor. Nobody wants to do more. They want to do as least as possible without being responsible and negative consequences. And so that's what you get when you don't have primary responsibilities, individual responsibilities, and you quantify them and train them. You get chaos and you get mess. So the next thing is the weekly assessment and acknowledgments of job responsibilities and satisfaction. And basically, everybody likes recognition, appreciation, and approval. And that has tremendous value. And it's real easy as a chiropractor, to always be talking about collections and missed appointments, right? And it's real easy. So next thing you know, because you're trying to, save your business and make it work and all that stuff. And so that's who you become to your employees. And that's not a good thing. And so part of the function of the weekly staff meeting is I always try to say something good about that person in their role. And I always try to say it in front of the other employees. Now, you're going to find that, it's not always, your stats are not always good. So even when there's a bad stat or it could be better, I always want to try to say something good about that person. So maybe they're good with people, or they get to work on time, or I'm always going to try to find something good about that person and say it in front of the other staff members. When you're going to say something personal bad, now it's a double-edged sword, because when you hold people accountable, like for primary statistics in a staff meeting, and they know they're coming to the staff meeting, and they know everybody's going to see these statistics, that's a tremendous motivator. Peer pressure can be a tremendous motivator, and I'll use it for that. But at the same time, when you say something personally negative to that person, it can be tremendously humiliating if it's in front of the other employees. So it's a real fine line of, identifying areas and statistics that are low and then training toward them to increase them versus being derogatory and negative to the person. Anytime that has to happen, that always is one-on-one in a room by itself. When you start to humiliate somebody, that's when everything goes bad. But I tell you, it's like a cancer. None of your other staff members want to see you humiliate another person. Human beings don't like to see that. And you will destroy the attitude and the respect if you destroy somebody's humility in front of them. So you have to be really aware of that. So anyway, having said that, and then you always have the annual assessments. There should always be a total annual review where it's a top to bottom total annual review, all the job responsibilities, all the functions, and you're critiquing them. Where are they at in the scale? And that should always take place. And then here's a category that is very misled often, and it's bonuses. So many times doctors think that the employee is motivated by money or they're motivated by a bonus. No. Remember, 80% of motivation is moving away from pain, not going to pleasure. Here is the formula. The formula is to offer the pleasure, in this case the bonus, but it's also having the system, in other words, the steps and the training help them get there. That's the middle part. And then the left part, the pain, is what's called the minimum expectation of results for primary responsibilities. In other words, I want them to know what is totally unacceptable. Now, this only is for the primary responsibility. So whatever that position is, I let them know what is expected, what's bonused, and I train them to do it. But I also let them know that this is totally unacceptable. Now, one of the things about the minimum expectation of results, it's a tremendous motivator, because that's where the termination occurs. And I let them know. I said, this is where this is bad ground. If a statistic stays here, we either need to train, we need to do something, but this is where the job's in jeopardy. And I just want you to know that. And employees want to know areas where their job's in jeopardy. They want to know. They'd rather know it than not know it, and then and then accidentally go there and then cause trouble. So it's the minimum expectation of results. Let them know what it is. And one of the other major categories with the minimum expectation of results is it is not average. It is not average. It's way below average. Okay? So don't think the minimum expectation of results is average. No. It's way below average. But it's at a point where if it stays there for any length of time, it's termination. We can't exist as a business. It's that kind of a statistic. So always have a minimum expectation of results. Okay, as an example, the front desk person's primary role is percentage of appointments kept. And the average is 94%. Above that, they're bonused. So I would not say the minimum expectation of result is 94%. And I wouldn't even say it's 90%. Okay? I'm down to like 80%. So we're talking about real low. In other words, there's room to move and there's room to get better. But it's a low enough statistic that if I got 80% and I routinely have 80%, in other words, I'm losing 20% of my business every day, either she's going to get trained, she's going to get fired, because the patients are firing me. But that can't happen. We can't have 20% of the patients fire us every day. Okay, so that's an example of minimum expectation of results for a primary responsibility. And remember what I said, that's the motivator. They want to move away from that way greater than move toward a bonus. Okay? The other thing that happens is when you tell them averages, when you say, here's your average stat, 90, like in this case, it was 94%. What will also work for you is peer pressure. When they come to the staff meeting, everybody's going to know what the primary stats are for each employee because it's talked in all the staff meetings. That's one of the things you do at the staff meeting. So what happens is they will be motivated even more because they don't want to show up at the staff meeting. They don't want you to yell at them. They don't want to feel like they're letting you down, and they don't want to risk losing their job. All of those are true. But they don't want to show up and look like a putz in front of the other employees. And that is a good motivator. And so I want that to be in the public. I want the other employees to know the stats and if that person is making it or they're way behind or they're getting bonus for it. I want to use it as peer pressure, as a motivator. And they will. They'll even try harder because that's one of the components, okay? So the next one here is the cause of dismissal based on the job responsibility. Now, this is a touchy subject, but it's a very important motivator. Remember, when we talk about motivation, we're not just talking about pleasure. We're not just talking about pain, but we're definitely talking about pain because that's where the motivation's at. And then we're talking about the systems and the training in the middle. So there's three categories of motivation. You know, it's the pull, the push, or the pull, the push, and then the systems and the training in the middle that gets them from one point to the other. So you always want to let your staff members know what is the reason for them to be fired based on their job responsibility. Now, that's their primary role. So now you're back down to the minimum expectation of results. If it stays there, and no matter what training you do, by the way, we don't just fire somebody because it hits there once. So it has to be consistently, and I always say if you at least train them 3 times, and they can't, and you take them through the 4 stages of training, not one. In other words, you actually do training right. You take them through the 4 stages of training, and they still can't get it after 3 times. Chances are they're never going to get it. But it also means you have to take them through the 3 stages of training and not just say, here's how to do it, and walk away, which is what most chiropractors do. So you've got to put that time and effort in to get them through all 4 stages of training. So having said that, they want to know, employees want to know the cause for firing. And that is a great motivator. So don't be afraid to talk about it. You want to make darn sure you do talk about it. I mean, I used to joke, and I used to say one of the biggest motivators I had with my staff, and it was a joke, but it wasn't a joke. And I remember often, it'd be a nice day outside, and like my office manager would say, "Oh, it's a nice day out. We should just close the office and be outside." And I'd say, "You can." I said, "You have that option. You just got to suffer the consequences. That's all. But you can go out there right now if you want." So it was jokingly, and it was said jokingly, but the underlying point was, no, there's consequences. If I do it, and then I said the same thing. I said, if I do that, if I shut down, there's consequences for me too. Those patients are going to fire me. I said, they're not going to fire me. They'll fire you before they'll fire me. So this is a topic not many doctors want to talk about, but it's a tremendously powerful motivational topic. And I don't hold it over their head or anything like that, but they have to know what the bottom is. They got to know this is the bare minimum for a primary responsibility. We should be able to get through it. We should be able to increase that statistic with 3 training sessions if I go through all 4 stages of 3 training sessions. And that statistic will come up, and the job won't be an issue. We should totally be fine. But we can't stay down at this low performance level and train. And I'm just telling you, you say that, you just got some people moving. Everybody's moving in that office right now. Now, the next one is the case for extraneous circumstances. That always has to be known, whether to be extraneous. And in the handbook that I give out, I have a short list of extraneous circumstances that are always terms for immediate termination. And, some of them that I talked about is they can't talk about money with other staff members. That's grounds for immediate termination. That just stops the bickering of who's making what. Okay? So those are some of the examples, and I have a whole list that I go, it's a short list, but employees want to know, not only do they want to know it, they want to know, everybody wants to know boundaries. I mean, if you have kids, you know this. Don't give your kids boundaries and watch what happens. What happens to productivity, respect, authority? It all goes out the window. Well, employees are no different. Same with patients. They need to know boundaries. They need to know left and right boundaries. They need to know pleasure to pull them forward, and they got to know the pain to stay away from. They have to know all 4 of these boundaries. And so now we're talking about the pain-based boundaries. So don't be afraid to talk about them. Be very clear about them. And it will be, number one, it'll help stop it from going there. Number 2 is it's a tremendous self-motivator when you're talking about things that'll get them fired. That puts a big fire under somebody's butt is what it does. So having said that, also relative to the bonus, the bonus is always, remember we talked about this when I talked about bonuses in great detail, but you never give a group bonus. Never. You may give them a group award, and then that's what's called a token. It's not a bonus, it's a token. And the example that I give is like if you have, number of office visits for the month or new patients for the month or whatever. In other words, you never give a bonus on something that there's 2 or more people involved with, because you're guaranteed to get the lowest productivity, number one, because one person's going to ease off because they're going to say, oh, I got the other person to help. So it's going to lower productivity. Number 2, one person's always going to produce more than the other. That's why socialism never works, because somebody's always willing to work harder than the other person, and then they get pissed off when they're getting the same. So now you're bonusing the person who's doing most of the work, who got most of it done. You're bonusing them the same as the low achiever. And that creates tremendous internal staff problems. And that's why you cannot bonus as a group. You're going to do nothing but create problems. Just give a reward. That's it. And an example that I always did say, if there's so much in productivity or whatever, I just say as an office number, as a kind of a morale thing, a focus thing. That's all it is. You're not going to get high, sharp precision out of that. You're going to get the lowest performance there is when there's multiple people that are given the same responsibility. And I say, give a token, like example that I used to do is like movie tickets or a dinner for 2. And I just say, make sure whatever it is you give them as a token, it's under the cost per for one visit. So if you have a $50 per visit, just don't go over that. Just, make it $10, $20, something like that. It's just a token. Nobody's going to produce, guns to the wall, so to speak, when it's a group. It's just not going to happen. Individually it will, and that's why you put bonuses on individual people, because now it's the American way. It cuts them loose. It gives them full responsibility. It puts responsibility on them, creates a lot of pain if they don't do it, and then it personally rewards them for doing it. It's the American way. So that's so if you want to start killing your office and creating internal problems, go ahead and start bonusing everybody for the same thing. And then we talk about rewards and acknowledgments. And, I talked about public praising in front of and one of the great things to always do, and this is what I did, is public praising in front of the patients. Praise your staff in front of the patients. And I'm not like that normally, so here's what I did. I just had a phrase, and I would say that phrase. And the phrase I'd say a common phrase I used to say is, she's the best. That was my way of praising. And I used to use that a lot. And I used to use, she's a VIP. I'd say that. I said that to the patients too, but I'd say that to staff members. But mostly I'd say, she's the best. And here's an example. In front of patients, I'll always want to try to take, if that opportunity exists, I want to say it in front of the patients. Is when, like say the therapy, let's say I'm in the therapy room for whatever reason, and there's my therapist, and they're putting, she's talking with the patient, she's put them on therapy, or she's doing therapy, and they're talking or whatever, then I'll say, that'll be a comment I will commonly say. I say, oh yeah, Mary, she's the best, she'll take care of you. See, that's the public recognition. And when I said, see, there's a difference saying Mary will take care of you, that's not recognition. But when I say, Mary's the best, she'll take care of you, Mary liked that. She liked it that I even said it, not that I just said it as her boss. She liked it that I said it in front of a patient. Get in the habit. And I would write that down. If you're not that kind of person, then I would I'd steal that phrase, write it down, and start saying it. Mary, say their name and say they're the best, and tie it to whatever job that they're doing as they're doing it with the patient. They're collecting money, they're doing scheduling appointments, they're doing paperwork, they're doing therapy. Oh, Mary will take care of your appointment. She's the best. Mary will verify your insurance. She's the best. See, that's great language. So anyway, having said that, and then I talked about the team awards versus the individual bonus and the difference. All of these things are just unbelievably important motivators and how you do them. And then the fourth one is, and this is what I call professional or educational motivation. And people like to feel they're getting ahead in life or progressing, learning something new. People generally like learning something new as long as it does not challenge their security. If it challenges their security, it can create fear. But if it doesn't, security meaning their job. But you'll find that when you every now and then make sure you cover something that's not only beneficial for the office, but it's beneficial for that person as a human being that they can take and learn in their life and their experiences outside of your office. And I'll give you a couple examples. So I teach the staff and I always will allow others to teach my staff subject matter that will better themselves in their personal life. In other words, a lot of times when people don't feel like they're being challenged, and that's a common word you hear, I don't feel like I'm being challenged. People quit jobs and are bored because they don't feel like they're challenged. And this is the category this falls under. And so I always pay a lot of attention to things that help motivate, that's personal, that the employee, that's good for the office, but that's informative that the person can use. I'll give you a couple examples. One is the personality profiles. Teaching them the personality. Well, it's good for the office. It's good that they know that, number one, so they know how to work better amongst the other employees. So they know why somebody's more passive or more loud or more aggressive. Now they understand personalities, so that eases the tensions in all these, in these areas. Also, it teaches them how to relate to patients. But it teaches them, and when I taught it to them, I also taught it to them relative to their personal life. Who they married, the relationships they're in, their kids, what personality profiles, what are the pros and cons. I mean, I had all of my staff members not only talking about this, they were having their spouses take the personality profile test. They were having their kids take the personality profile test. See, because this was a betterment in life for them on the whole. And so that's what I talk about when I talk about professional or educational motivation. Same with the stages of 4 stages of training. The 4 stages of learning. That's just something they can take with them anywhere. Same with the phases of healing. I mean, that's every human being needs to know the basics. That applies to them and their family life. Outside of what you do, how their family heals when they have different injuries. And I'll give you a couple other examples. As I pay attention to this is at least once a year I would go to like a Parker seminar, but I never went to the Parker seminar for business. They're just not good at that. But they're typically pretty good at some motivational stuff. So typically what I would do is once a year I'd go to and I always wanted to go to the big one, like it was typically in Las Vegas. I'd take the staff so they could see something big. Okay, so I wanted them to see something big relative to chiropractic. But here's what I did. I always picked the seminar that I wanted them to go to specifically that was related to the office. It might have been some kind of billing or something like that, as an example, or therapy. But here's what I always did. I made sure that they went to one of the motivational, because they always have a motivational type person. And I remember one time we went, and it was Fred Dreyer. He was the person there. And, man, I tell you what, my staff talked about, they just loved that. They loved his message and what he had to say, because his message was about life. And they just loved it. And I remember they started buying his books and reading his tapes and, introduced it to their family. I mean, that is what you want to give as an employer. Things that help them on a personal level that they can use outside of the office. Be aware of that. And I'll give you a negative example. I was dealing with a doctor one time, and I was explaining this to him. I said, man, that's a great employee. He had a really good employee. I said, you should teach her this, and this, and move her up. I said, she's going to outgrow you. She's going to get real bored just running that front desk. She's got more value than running that front desk. I said, you need to step her up into higher authority, give her more responsibility, because that's the kind of person that will go get it. And by the way, if you don't give it to her, she'll go somewhere else because she'll get bored real fast. And he said this to me, and I couldn't believe it. He said, I don't want to do that. The more she knows, the more likelihood she's going to leave me. I could not believe He said those words. That was a unbelievably crappy mentality to have with your employees. In other words, keep their face in the mud so they can't see anything else and they stay put. That was the mentality. Now, here's the deal. Even though you don't say that to your employees, they'll feel it. They will feel it. So when you don't do these things, especially with people that like excel at a little higher and you don't kind of help them to excel and move them to positions to help you with your business, they will leave you. They will leave you because they're bored to death, especially if they knew your attitude. If she knew he said that, she would have quit on him that day. And by the way, she did quit on him. And as soon as she quit on him, I went to hire her. After she left, I didn't say one word to her. She was with her. But I knew she was gold. As soon as she quit him, I called her to hire her. Because that's a good employee. Now, so one other example is every now and then a seminar would come in, and maybe it happens where you're at, into the city, and there'd be like 5 speakers or, something like that. And they were big, like typically big name speakers, and it'd be like a half a day or full day down at the convention center. It'd be like $49, something like that. And it was like a motivation thing. It was like a human thing, right? And so I would send my staff down there, like a half a day, or, I'd make it work. Maybe, if it was during a business day, maybe, some of the staff members go in the morning, come back the afternoon, vice versa. In other words, all right, so I'll make it work. And I did that because of this reason, the professional educational component of helping them as human beings. It would naturally translate to my business. I mean, my obvious reason for doing it was my business. That was the reason. But I was totally cognizant of the importance of them from a motivational standpoint of their being educated and motivated, and not just about collecting money and scheduling appointments. And so I paid attention to them as human beings. And so that becomes a big factor. So having said that, when I come back and I look at all these characteristics, I mean, all of them are important, but I got to tell you, this one right here is probably number one. When you're teaching them all these things you do and how you do it and why you do it, that's what creates unbelievable respect and value and certainty and purpose. And if you're not doing that, you're not motivating your staff. And so make sure you do some of these basic things, and then same with the office purpose and the mission statement, but there's clarity. Why is your office there? What are a few of the bullet points of why you're there and what you're trying to accomplish? And what are some of the basic values that you hold? And I gave you the example with me, with money and time, with patience, making it affordable, not having them wait, just those are values. And I had long-term employees. My first employee was with me from start to finish, 17 years. My second employee was with me for 5 years. She graduated from college, went for IBM, and I went after her. After 5 years, I went after her to hire her back because of how good she was, and then she worked with me for another 7 years. Good employees are hard to find. You look for good ones, you hire them, and you treat them well. You take care of them, and these are the categories of employee motivation when I'm referencing taking care of them. And here's the opposite. When you don't do this, when you don't hire right, you don't take care of them, you don't know the basics of employee motivation, then here's what you get. You get a lot of strife in the office. You get bad systems. You get arguing. You get people that don't get along. You get high employee turnover, and you get low productivity. That's what you get. And you'll never grow a stable business. And I got to tell you one last thing. Even if you don't want to grow, there's tremendous satisfaction having people in place that are very good at their jobs, that you don't have to look over their shoulder, that have good attitudes and that are productive. That is worth something as an employer. It's worth a lot of peace of mind compared to running through employees. Even if you stay at the same visit amount and one of them you're stable the peace and serenity that you will have compared to from the junk of going through employees and hiring people and back and forth, because you're just not hiring people. You're not hiring the right people, number one. Number two, you're not putting them in the right positions and trained well and holding them accountable. And number three, you're not going through the motivational categories. And that's when you get crap. And it's when you get chaos, when you do all those things or a combination. So this is what I've learned, not just studying, but experiential hiring over. Now remember, if I've hired over 300, how many people did I have to interview? Thousands of people. And then all the experience that comes with this. And this is how I created stability, certainty, authority. And when I put that task over here, I was done with it, so my mind and my body could produce what I was good at and move on. And then I just come back and I would check that statistic in the staff meetings and see how we're doing. Do they need to be bonused? Do they need to be trained? Where's it at? And that's called management. And that's what I did. And that's how I went from one office by myself to 2 associate doctors to 2 offices to 4 to 5 to I had 77 offices in 9 years. I opened 77 offices in 9 years. In 5 years in practice, I had 35 offices in 5 years. And it was all these factors that allowed it to happen. Any questions about employee motivation? Hit your red button if you have any questions or comments about some of these things. I'd write them down. I mean, whatever you're not doing, I'd be paying attention to. These things, these things I talked about today will make or break your employees. And of course, none of this matters if you start with a bad employee. That's why we did the checklist on who to hire and how to hire. So none of this matters if you have somebody with a bad attitude and a bad work ethic. None of this matters. You can't train that out of them. So you got to learn how to pick and train, or you got to learn how to pick first. Then you got to know the systems and the 4 steps to training them, and then how to treat them with motivation. And that's how you create a lot of peace in your mind, a lot of stability, a lot of productivity, and build a business. Where I walked out of my business, literally walked out. I had 2 full-time associates. I walked out, made over $100,000 a year, and I wasn't even there. I was opening other offices. I was speaking at other colleges because of these systems. I never could have done any of that if I picked the wrong people, didn't put them in the right place, put them through the 4 stages of training, and use these factors as motivation along the way. I'd have been stuck like most people, saying 120, 150 visits a week.